And joining me now to talk about all of this is Dr. Raj Kalsi, board-certified emergency medicine physician, and Dr. Bernard Ashby, a cardiologist in Miami and Florida state lead for the Committee to Protect Medicare. Good morning to both of you. Look, I think you both were able to hear that clip from President Trump on this interview that's airing later today. And he made a couple of claims. First of all, claiming that there were potentially problems associated with mask wearing, and also that these doctors, Dr. Fauci and others, were wrong about mask wearing. We are seeing these numbers going all in the wrong direction. Dr. Kalsi, what do you make of the fact that President Trump continues to be so resistant to not just a mask mandate, but even just clear mask messaging at this stage in the pandemic?
Yeah, I think we need to resort now, America, to listening to science and local governance that are supporting our safety. I'm struggling in the emergency rooms that I work in, and I work in several, where I'm trying to convince people that are non-believers, and they're listening to leadership that are telling them that masking is an issue of politics and freedoms in this country. You also have the freedom to die from COVID, the freedom to be with this disease for weeks to months. That's also your freedom. And all of us in healthcare will fight for that freedom to keep you alive and well. But unfortunately, we're running out of steam. We need help.
Yeah, and it doesn't seem to be coming from the federal government. Dr. Ashby, I want to talk to you about what's going on where you are, where we're seeing some of these numbers in Miami-Dade County, 40% increases in just a couple of weeks in coronavirus patients. ICU beds are filling up, more patients on ventilators than have been all month. What are you seeing in your practice, and are these patients I'm curious about what you think about where we are in terms of the cycle between illness and hospitalization and then mortality.
So, great question, and thanks for having me on. Well, Florida in general is doing poorly when it comes to controlling this virus. Miami-Dade in particular, we are at a point where there's a rapid rise in the virus. The hospitals are overwhelmed at this point. The ICUs are over capacity. My hospital in particular is at capacity, and this virus spread is going on unchecked. We're doing piecemeal approaches to try to reduce the virus transmission, but it's not nearly enough. We need more backing from our federal, state, and local officials to bring this virus to heel, but that's not occurring right now. So the medical professionals, we're doing our job. The case fatality rates are decreasing because we are actually much better at treating the virus. We are instituting methods such as early use of remdesivir, dexamethasone, trying to avoid folks getting on the vents and using high flow oxygen, but we can only do so much. And so now you're starting to see an uptick in the death rate. And so over the past few days, we've been well over 100 up until yesterday. And that's an ominous sign. And the fact that we have no definitive plan to decrease the spread of the virus is very concerning, to say the least.
Yeah, at the same time, back in Washington, we are reporting this morning that President Trump and the White House are at odds with Senate Republicans over this issue of whether the CDC and the states need more money for contact tracing and testing. We've been hearing these reports for days and weeks now. Testing in particular seems to be at an acute problematic level right now. People are waiting long periods of time for tests. Do you think that there is more money needed, federal funding, to go toward both of those issues? Will it help you at this point, Dr. Ashby?
The fact that we're even having this conversation is the problem. The answer is yes. We need resources, we need support. We need to treat this like a FEMA-level disaster response. I'm a Florida boy. America is, or at least Florida, we're in the eye of a hurricane right now. So we need to have a disaster relief kind of mentality. And the fact that we're talking about, or at least debating whether or not we should get funds and resources to support our ability to control the virus is to me, is just, insane. And so my message to the leadership is just do your job. We medical professionals are doing our job. Just do your job, have our back, have your communities back, or have our communities back, so that we can, bring this virus under control, so that people can go on with their lives and not worry about literally dying. Because many of my patients, especially in my clinic, they're literally worried for their lives, and they've been on lockdown since February.
Yeah. Dr. Kelsey, just this weekend, the CDC put out some new guidance for what people should do if they're treating themselves at home. I know this is a real issue for so many Americans who are maybe not hospitalized, but they've been diagnosed with the coronavirus. What's key about this is that they're saying 10 days, after 10 days of first showing symptoms, you can, and at least 24 hours have passed since your last fever, you can leave isolation, or if your fever's passed without medication and you've taken 2 negative tests. And then for people who are asymptomatic, which we also are seeing a lot of, you can see people can discontinue isolation after 10 days after their first positive test if they haven't had symptoms. And they can also leave isolation if they have taken 2 negative tests. Dr. Kelsey, are we learning more about how, the duration of this virus, how contagious people are? It seems we went from 14 days to 10 days. Is that significant? And do you agree with these guidelines based on what you're seeing in your practice?
I got to say that I trust that the CDC is using good judgment and good clinical data to make these decisions, but boots on the ground, this is entirely arbitrary to me. When they put out statements like this, what's sort of imperative to making this happen is that people can get rapid tests. Rapid tests means same-day results or even same-hour results, and we're just not getting results for days. So that breaks down the entire component of 10 to 14 days. It's really kind of a moot point for me, because what's happening is in that same household, if we don't know who's infected, other people are getting infected, and if people are just waiting for this result and going on about their lives, they're infecting other people in the same time. So 10 to 14 days doesn't really make a whole lot of change for me. Boots on the ground, I'm still seeing people co-infecting other people in the household, people at work, and the blue collar community, and my community in particular, they're the ones coming in, getting admitted, and having the worst symptoms of this disease.
Yeah, it all does seem to come down to this issue of testing. Can we get people test results quickly enough that they can actually isolate themselves and not infect others? Dr. Raj Kelsey, Dr. Bernard Ashby, thank you both for joining us this morning.